Sex,
Sex? Did you say sex?
as prescribed. Take your medication, exercise, and diet. On 88.5 Sufra FM. Tell a friend, call your neighbor. Casualty 911 is on.
Good morning, everybody, and welcome to a new edition of Casualty 911 on 88.5 Super FM. I am your host, Fawn Minpiel, and it's always a pleasure to be here on a Monday morning. As you might be able to tell, my voice is not the best this morning, but we will try our best to get everything rolling as per usual. Okay. To our regular listeners, welcome back. It's always a pleasure having you with us. To those of you joining us for the first time, we hope that you will enjoy the program, and we always love to have some feedback. So, in terms of participating via questions or letting us know what you thought about the program, we particularly like when you have some constructive criticism in terms of improving the quality of the program. So, having said that, I wish all of you a wonderful Monday morning. As I said, it's a pleasure to be here. Today, the 7th of April 2025, is World Health Day. This year, the focus is on maternal health and newborn health. The theme is actually healthy beginnings, hopeful futures. And the World Health Organization is urging governments and health communities to increase the efforts to end preventable maternal and newborn death, because I'm sure that some of you may be aware that there are quite a few people who lose their lives during pregnancy, childbirth, and newborns also die without having had the chance to live for a long period of time. So newborns dying in preventable ways. So the World Health Organization is urging countries to prioritize maternal and newborn health, maternal and child health. It is said that there are close to 300,000 women who lose their lives worldwide due to pregnancy and childbirth every single year. And that is greater than our population, our entire population in St. Lucia. So we really need to be aware of those things. And we'll talk today about what our situation is in St. Lucia in terms of our maternal and child health program. We will be looking at some of the threats to maternal and child health, the progress that has been made in St. Lucia over the years in terms of improving that, and how we can reduce the possibility of those threats to maternal and child health, whether it is disease, injury, or disability. Based on current trends, according to the World Health Organization, 4 out of 5 countries are not on track to meet the 2030 maternal survival target. So I am thinking and hoping that St. Lucia, we are in a very good position. And to speak to us today about our maternal and child health in St. Lucia is Nurse Yasmin Gabriel. She's the Public Health Nursing Supervisor for Region 7. Nurse, I'm sure before we start our discussion, you will tell us a little bit about your service. If you are a public health nursing supervisor, that means that you have quite a history. You have been around for a little while. So tell us a little bit about your career in nursing and excuse me. And also, what when we say health region 7, what area that covers, and then we will get into our discussion. Welcome to Nurse Yasmin Gabriel. I am very happy that you are here with us. It is a pleasure to have you, and I look forward to our discussion today.
Good morning, everyone. Thank you so much for having me. It is a pleasure to be here. As Son mentioned, my name is Yasmin Jules Gabriel. I am the Public Health Nursing Supervisor of one of 8 health regions in St. Lucia. My region is Region 7, that's Ancillary Canaries, and the wellness centers within that catchment are Laqua Wellness Center, Ancillary Wellness Center, Canaries Wellness Center, Jackmel Wellness Center, and Banner Wellness Center. So to all of my staff, I wish you a very pleasant good morning and a good morning to everybody else.
So thank you, Nurse. So can we get right into our discussion?
Certainly,
Yes. Okay.
certainly.
So I mentioned maternal and child health. So I would like you to break it down for us. Give us an idea of what, when we talk about maternal and child health, we talk about, where we are at and targets and so on. But what is really involved in maternal and child health? What does that cover? What aspect of life? What span does it cover for the mother when we say newborn? How long is a newborn a newborn? Okay, so if you could just explain that to us a little.
Okay. So we would have heard the word maternal, maternity, we think of that, childbirth. And it is more than just childbirth. Maternal health looks at the health and care of the woman who is going to have a baby, who has planned to have a baby, before she has actually had that baby, involving her partner, her family in that plan and in that care, and we look at her health and care during the time that she's pregnant. We look at her health and care when she's delivering, during that delivery, and also the 6 weeks after she has delivered.
So when we talk about newborns, what
Mhm.
period of life are we speaking about? Is it when they're just born, maybe for a couple of days? What span are we looking at?
So our newborn, what we call a neonate, is up to 28 days.
So that's about a month.
About a month, about a month. And after that, they are infants up until they're 12 months old. And from there, they're toddlers and moving on to when we get to our years where they go to preschool, they go to kindergarten, they in grade school and write common entrance where they go into secondary school. And all of this period is our childhood period. So when we look at child health, we look at from that period. We look at them before they were in mommy's womb, yes, but after they're born, that 6 weeks period after they're born is very critical. That first 10 days after they deliver is very critical as well, and we continue monitoring their growth and development, making sure that they're where we want them to be in life, along with where their parents want them to be in life. It's a partnership, we're in it together, and we want to have them under our wing, under our care through the adolescent years up until they're about 19 years old.
Okay. So as it relates to the theme, when we speak about maternal and newborn health, we know that women don't go to the community wellness centers to give birth.
Yes.
So we know that that part of it may be outside of the scope of the community wellness centers. But in terms of the maternal and child health program, the existing maternal and child health program, what kind of services are available to women who are pregnant, or women who, you said, even before they become pregnant, so women who before they become pregnant, are planning to have a child, although a lot of, I mean, I'm pretty sure quite a few have
Yes,
unplanned pregnancies. But for those who actually plan, what is available, what services are available to them, what can they expect at a community wellness center? Because quite a few people take the option of going to a private doctor
yes,
for the entirety of their pregnancy or even before when they're planning. So
of
could
course.
you just tell us a little bit more about the maternal, at least the maternal
Yes.
aspect of the maternal and child health program?
So it's important that you mention planning, and planning is important. We do have women in St. Lucia. We have families that do plan their pregnancies, and we hope it's something that happens on a larger scale. It may not be to the extent that we want, but we do have families that plan their children. They plan when they're going to have them, and that is called preconception care. So we provide at our wellness centers preconception planning and counseling. So you can come in to get advice and training on when you can, when is the good time, when are you ovulating, how do you know when, if you want to start your family, how do you know your body is ready to conceive? How do you know that you're ovulating? Learning about your body and the reproductive cycle, all of these things are important. And we do not extend that service just to the woman. We want her partner there as well. We want the husband there as well. We want the boyfriend there as well. Because as I said, it's a partnership. And if both of them have the information, it's easier for both of them to be on the same page. And in that preconception stage where we provide that information, they learn how they can do this safely. And part of that, for some people, they may decide, I want to be on a contraceptive method, what most people call family planning. So that family planning helps you space your children so you know how soon you want to have them. Somebody may come in and say, I want to start a family and I have a baby now. I want to have the next one in 6 months. When we sit and take a history, it might be determined that it's not safe at all for you to have a next baby in 6 months. Are you prepared? What did you put in place? What can you do to be healthy to prepare for this next pregnancy? And that's where our family planning comes in. And we provide a number of family planning services, contraceptions. We do have contraceptive tablets. We do have contraception injections. We provide condoms. Not everybody wants to use um, some type of hormone. Some people just prefer to go very natural. And all that is okay. It's all about choice. But with these choices, we want people to make safe and healthy choices. And that's what one of our primary responsibilities in the health center is. When this person has finally become pregnant, we encourage them as soon as they know, come see us. As soon as you know you're pregnant, come to us. We'll be happy to have you. We're going to register you into our antenatal clinic. That is a clinic for pregnant women. And during that clinic, you get to have on your first visit a physical examination, head to toe. This may be done by your nurse midwife at the health center, or it can be done by the family nurse practitioner. After that, we go ahead for us to send you to do your labs under the UHC. Clients who are pregnant can now get their blood test free of charge, their antenatal blood test, their pregnant women blood test free of charge, one ultrasound in each trimester. They can get that done free of charge with their voucher, of course, to a number of places around the island. And these things are to facilitate the client being able to get access to the care easily, being able to get access to the care without worrying about the cost, without worrying where the money will come from. Do I have to choose between sending my last child to school and paying the bus and doing my blood test? So these things, we try to make them happy with that, and these programs were set in place from last year, June, I believe it was.
Okay.
Yes?
So, so you spoke about the blood test and the ultrasounds, and I expect that these are key elements in determining risk to both mother and child. So if that is covered, it would help to reduce some of the threats to both mother and unborn child.
Definitely, definitely.
Can we speak about some of the other threats that could possibly lead to, you know, that maternal disability or injury or death, because the theme is maternal and newborn health and reducing the risk of death
Of
in
course,
pregnant women, women during childbirth, soon after childbirth, and their newborns.
of course. So our services and policies are all aimed, they are designed to reduce maternal and infant illness, to reduce disability and death. And you've mentioned that from the beginning of the program. We prioritize maternal care. We prioritize the care of the woman being able to go through her pregnancy safely is very important to us. Being able to not have to have as little and life-threatening complications during her pregnancy, that is a priority for us. And being able, after she has had her baby, for her to be able to leave the hospital and for that 6 weeks after to be able to properly transition back to her pre-pregnant life, we want to know that she can do that very safely. She has all the skills, all the necessary things that she needs to be able to do that. She's equipped with that. I didn't mention earlier, but one of the things that is offered as part of our services includes nutritional counseling and mental health screening and support. And when we think about the threats, things like nutrition and mental health do impact the health of the pregnant woman and impacts her health and how she cares for her baby after she has delivered. So if we're just looking at during her pregnancy, some of the threats would be things like weight gain, being obese. Things like obesity increases the woman's risk for getting diabetes. Diabetes, we know, is very prevalent in St. Lucia, what a lot of people call PISADO. Some women start out with normal pregnancies. However, during the course of the pregnancy, just because of pregnancy hormones, they become at risk, high risk for diabetes, or they get diabetes in pregnancy, which is called gestational diabetes. We do screen for that. So that's something that we do for all pregnant women because that is a serious risk that can happen with all pregnancies. And another
While
thing,
you're on the wait a bit, nurse,
okay,
just to,
continue.
I don't really want to cut your train of thought, but since you were speaking about obesity and weight gain, I think culturally women tend to think that that is just a period where you at
You eat
liberty
a
to
lot.
eat as
Yes,
much as you want and whatever you want because you have those cravings and you don't
yes.
want to get gas and you don't
Uh,
you don't want to make the baby uncomfortable in any way. So how do you work around? How do you guide people away from that mindset during pregnancy?
So it's very important for our women who are pregnant to know that there is an acceptable amount of weight gain during pregnancy, and that is between 15 to 25 pounds. Some of that is just maternal fat. Some people tell you, I'm pregnant and now I'm full. That is maternal fat. Some of it is the increased blood volume circulating in the body. Some of it is the baby. Some of it is the fluid around the baby. And when women start understanding that these things do add to the weight gain, and they're not eating for two. We encourage them to eat healthy. And part of what we do with each antenatal visit is that we encourage women to eat healthy. They are guided on how that can be done. Um, Exercising during pregnancy is normal up to a certain point, and there are low impact exercises that women can do as they continue. So a lot of times our women may think I'm pregnant, I'm not supposed to be doing anything other than lie down and eat. And we let them
Absolutely.
know absolutely something we see all the time. But we can encourage them. You can go for a walk, you can go swimming. There are some little activities, some exercises that are safe to do during pregnancy. I had a client who was a fitness instructor, and she exercised until her 9 month, but she was a fitness instructor from before, so that was part of her lifestyle. And she had a very safe delivery, and she was so excited to tell me about it. And the good thing for her is when she came back to me after her 6 weeks, she said, "Nurse, can you see the belly is going down? I didn't know that all this exercising before was going to be helping me at that point." So having that extra weight gain is harder to lose at the end of the pregnancy. You can eat and you can have the cravings, but the key is to do it healthy.
Okay.
Everybody has a little garden. You can find just about anything in your little garden to help to help keep that appetite, give you the nutrients that you need, but also will prevent you from gaining weight.
Well, nurse, thank you for that. But I guess we don't want people to think that during pregnancy is a good time to go on a diet and start exercising it at levels that they have never exercised before because they don't want to gain too much weight. Or when they
Mhm.
go to the nurse and the nurse says you have gained a certain number of pounds, they feel I have to reduce because that would not be safe for either mother or child, right?
That is correct. That is correct. And at each visit, we monitor the weight. We monitor the weight from your last visit, compare it to your current visit, see how much weight you've gained, and we can let you know whether or not that is a safe amount of weight. That is important to know. A lot of times, person seeks services and they just come, I check my pressure, I check my sugar, I check my weight, and they walk out. But knowing what these numbers actually mean for them and their health and what they can continue doing when they leave us is important. So when you come and your nurse says, "Hey, I noticed you put on good weight." What does that mean? Ask. "Nurse, how much weight was that? That's a good amount of weight. Did you mean 3 pounds? Is that a good amount of weight from the last time I was there? Is it too much weight from this time? I noticed I've been having the cravings and this is what I feel like eating these days. What do you think I can do to help that?"
So you're encouraging your patients and your clients to have that rapport with the nurse. Sometimes people
Definitely.
go and they have questions, they have concerns, they have doubts, and they don't ask. So it's really important that they have a conversation with the health provider,
That
whether
is
it's a nurse, a
correct.
doctor, whoever it is, to have that
That is
conversation
correct.
so they walk away with all their doubts cleared up, all the clarification that they need on everything.
Definitely.
So I don't
Definitely.
want to dwell on the weight too much as a
Mhm.
threat, although, as you said, overweight, obesity has other associated risks. So you were speaking about
Right.
diabetes
Yes,
and probably the pressure as well. Are there any
definitely.
other associated risks that we should know about as it
Before,
relates to weight?
definitely. And before the woman delivers, one risk that we see a lot is our pregnant women coming to seek care late. I had a baby before. I know what to expect. I know what to do. This is my fifth child. This is my eighth child. The nurse not telling me anything I have not heard, and they come and seek antenatal care late. They get their blood test late. Seeking antenatal care early, registering for your antenatal clinic and your services, it's important because then we get to monitor you throughout the pregnancy to see how healthy that pregnancy is. Are you coping well with that pregnancy? Is your body coping with it well? Is baby okay? What is happening? When you come to do that late, we pick up problems late. Like take for instance, one threat is a low blood level. A low blood level or anemia can threaten a pregnancy and it can even put the life at risk during delivery, cause you to hemorrhage, it can cause your blood pressure to drop. There are instances where people may need blood, but we will not know If you come to us late, we will not know. And one of the easiest ways to come and know where you at, how healthy you're doing, how well your body is coping with this pregnancy is to come to your routine, regular antenatal clinics so you can have your routine examinations done. We can see whether or not the pregnancy is progressing as we want it to. Another threat that we are afraid to actually talk about is domestic violence. Domestic violence is a threat throughout the pregnancy, before, during, and after. Because with domestic violence, you can have forms of violence where finance is withheld, people cannot get to eat food properly, they cannot get to leave the house to come for their antenatal care because their partner has decided they're withholding funds from them. Luckily, we have the blood tests and the ultrasounds that you don't have to pay for, and that's one thing that takes care of this on that end. Um, but domestic violence is a serious problem that may be a lot more prevalent than we think. In a room of in a room of 4 women, one out of these 4 women is going to be a victim of domestic violence.
And
And
when you speak about domestic violence, this, I suppose you refer not only to physical violence.
yes, we're looking at financial abuse, we're looking at emotional abuse because all of these impacts the lady mentally. It impacts the pregnant woman mentally. It's her social system. If she doesn't have the support that she needs, all of these things can add more anxiety and depression with the pregnancy.
And how is that a threat to maternal health or to the health of the baby that the lady is carrying, to the fetus?
So if we're looking at physical violence, we're talking people literally coming to blows. That woman can have physical injuries that can cause her to land in the hospital because of broken bones, injuries that she cannot hide with a little makeup. Yes, that can also include physical injury to the baby. There's that nice fluid around the baby that protects it. However, a baby who's exposed to that type of violence, physical violence, can experience injuries in the womb. That can also cause them to go into premature labor, have the baby too early. Based on how early she has that baby may be premature and that baby may not necessarily survive. Yes, there are a lot of costs in taking care of of a premature baby. It's expensive and it's time consuming and it is emotionally exhausting. It takes a lot of resources from you. For the woman, all forms of abuse takes its psychological toll, its mental toll on her. And some women do experience anxiety and depression during the pregnancy and that can worsen after they deliver. And most women will experience what we call postpartum blues, feeling a little teary, crying for no reason after you have the baby. But some women experience something a little more serious, postpartum depression or postpartum psychosis, where the woman is unable to care for herself, she's unable to care for the baby. If she's depressed, she doesn't have the energy, she doesn't have the will, the drive for her to take care of herself on a daily basis. How can she take care of that newborn? How can she recognize if she's having a complication from maybe her breasts are engorged, her nipples are cracked, the baby could be very cold and baby's having trouble breathing, if she got stitches or she's having an infection, how does she recognize that? Because her mental health is impacted. She's having that postpartum depression where she doesn't have the drive to take care of herself. She doesn't have the support system either to be able to do that. And the mental health, that's where our mental health screening comes into play. We have a mental health nurse practitioner who is involved in our antenatal visits. So she gets to screen our women to see if they're at risk, what the risks are, and she provides the necessary counseling and support to guide them through.
Okay, wonderful. So, nurse, while you were speaking, a thought came to mind. If a woman is experiencing postpartum depression, how would the people around her be able to identify or recognize the signs and symptoms of that postpartum depression? And how would they know when it's necessary to seek help for that individual?
So one of the things that they would notice is that person doesn't take any interest in the baby, no interest in the baby, no interest in themselves. They may not get up and have a shower. That lady may not want to eat. She may not have the appetite. She may not be thirsty. You may notice that all she does is lie down. You may notice that the baby is crying and she will never get up. She will not get up to watch the baby. She will not get up to look at the baby. She will not get up to feed the baby. All of these things are little warning signs, little things that would pick your attention and say, but wait, this is not normal. Is something going on here? Another thing is that you may notice that, newborns have to be swaddled and kept warm. She may not be doing that. She could be overwrapping that baby where that baby is overheated, lots of layers and layers. Or it could be cold out and she just takes that baby, puts the baby on her shoulder, and heads outside. No warm blanket, no hat, no nothing. It is one of the signs would be providing care for the baby, but not doing it safely.
Okay. I think sometimes, we may miss the signs
Mhm.
because we come to the conclusion, we just believe that that person, as we say, Munsala just family.
Yes, yes.
So, so you
Sometimes
may
people
not
think
even
like that.
approach the person, or if you approach them and you get a certain response, you just leave them alone, and
Leave them alone.
you don't continue to pay
Mhm.
attention to them.
Of
So how
course.
do we should people step in when they see that sort of behavior?
The way the world is
What's
moving
your
now,
suggestion on that, nurse?
that is a tricky one. Um, that is a tricky one. However, we have a certain level of rapport with our community members, with our clients, that sometimes they do see certain things. They may not tell the person, but they may come to us and say, Nurse, I noticed such and such and such. But we in ourselves, we nurses, we do home visits for persons who have had babies as well. So we can get to visit the home and assess what the home environment is and basically let our eyes put our peas, see if what we're seeing is anything that's putting this newborn at risk or even there's a risk for the mother, something that's happening, and then we can step in. There was a time where in St. Lucia, you had a baby, all the ladies in your neighborhood stepped in. People came to clean for you, they washed for you, they cooked for you. Everybody made sure you had your fish broth. They took the baby for a walk and so on. But times have somewhat changed, but we still have people like that. We still have people like that within our communities who share that concern, who are not afraid to speak up. They may not be overbearing in doing it, but they would still recognize it, and we want the community to know, we want persons to know that we are there. The health center is there, the wellness center is there to provide you with any support that you need. What we don't have within the wellness center, we will find what adjunct services, adjunct ministries are linked with us that we can provide you with that service.
So, can you share with us any other threats to, maybe not life threatening issues, but they could be issues that could endanger the mother in terms of injury, disability? I think we mentioned in terms of the exercising, you may injure yourself if you go out
Yes.
exercising when you have not been regularly doing that. Oh, I forgot. There was a question that came to mind while you were speaking. You
Mhm. Tell
mentioned
me.
the home visits.
Yes.
Is that a routine part of your program within the communities? Or is it something that is done when, when there maybe the individual may have had a difficult pregnancy and you feel the need to follow up. Is it something that is done routinely for all your clients?
So some clients may not necessarily come to us. We people have choice. They have the option of seeing their private doctors if they want to, and we may never meet them. However, we do have our community health aides, our CHAs, who go. They're field officers. They're community field officers. They may come back and say, "Nurse, I passed. I saw baby clothes on the line. I didn't even know this person had a baby." Even though that person does not come to us, we would get up and go see them, because home visits are part of our routine services that we do. There are instances where we may not see somebody, we may know, get that call from hospital. Hospital does inform us when our clients are discharged. They let us know that this person has delivered, they delivered on this day, and they were discharged on this day. So the first 10 days after delivery is critical for us to monitor how this person is doing. And if we don't see them, we know they discharge, we don't see them in a few days, we have a responsibility to go find them to see what's happening. Sometimes people have cesarean section and they're in pain. They cannot leave to come to you. If they cannot leave to come to you, you need to go to them.
This why are the first 10 days so critical? What are some of the issues that may arise? Why is that period so critical?
Mm. So the first 10 days is what we call the puperium. And during that 10 days, we need to make sure for the mother that the breast milk has set in, that she is breastfeeding properly, that the baby is latching onto the breast properly, that she's not developing any complications or infections. We also check that the womb is nice and firm. It's supposed to have the nice consistency of a grapefruit. So we want to feel it. If we don't feel it there, we know that the womb is not doing what it's supposed to do after she has delivered. We monitor the blood flow after. We want to make sure that there isn't an infection setting in. If she has had stitches, if she has had surgery, is she healing well? We want to make sure that the baby is breastfeeding well. Baby is actually feeding as baby is supposed to. We know some babies born nice and plump, and during that first few days, they lose some weight, and that's normal. But there are some persons, because breastfeeding for them might their first contact with breastfeeding may not be the most pleasant. They may not want to breastfeed again, or they might be afraid to breastfeed. And they may not be feeding baby as often as baby should be feeding. So we monitor the baby as well. We check that the baby is not getting dehydrated. We make sure that the baby is breathing well. We made sure that the baby is passing stool, baby is passing urine. We getting enough wet and dirty diapers for that period of time. If we're not getting enough, that tells us that baby is dehydrated. Maybe baby is not getting enough breast milk, baby is not getting enough by mouth, what is happening? Then we need to go and assess that situation and see what's going on. We also monitor for jaundice, yellowing of the skin and the eyes. And baby not drinking enough may not be may be dehydrated, can cause that. So we check for all of these things. All of these things can increase the mother's risk for having further complications or worsening complications, and it can put the infant life at risk. Babies have to be kept warm. A baby who is not warm is not going to be breathing properly. Some people may not realize that. Some people may overheat the baby because somebody said, hey, the newborn has to be warm here. So I put a blanket, I put the woolly one, I put the onesie, the socks, the fans, the this, the that. But they hot in the house, all windows closed, and they sweating, and baby is swaddled with everything, and baby is getting overheated. So all of these things let us know Let us assess. That first 10 days lets us assess the care and handling of the newborn and the mother's condition after she has had the baby.
That's wonderfulness. That is wonderful. Um, because, sometimes people may feel a little frustrated and irritated by the fact that they have to, soon after giving birth, you have to find your way to a health center,
So,
and
mhm,
sometimes the arrangements that have to be made in order to get there, it creates more stress for the mother and so on. So if it can be done at home, that's wonderful.
mhm.
And if it's not happening throughout all the regions, I think maybe people, nurses should revisit revisit it, because that sounds so wonderful. It might even tempt me to have another.
Hey.
I'm just joking. As they say, "Leva pusa hapase." All right. So before we move on this, I just want to let you know that we're getting a few comments from our listeners.
Okay.
Somebody is agreeing with you. Miss Gloria Leon is agreeing with you that the neighborhoods are not as they used to be before in
Mhm.
terms of the support, I suppose. She says, sorry to say people don't do that anymore. I guess she was referring to the whole neighborhood
The
support
neighborhood supporting
coming in
you.
to help you out with all your chores. We also have somebody joining us from Miss Adelta, sorry, my eyes, Adelta Bowens, watching and listening from Bay Gutter Fancy, St. Vincent and the Grenadines. So that's wonderful to know that we have listeners so far away.
So far
I mean,
away.
we're
Let
on the
us know.
internet, but at the same time, sometimes we tend to think that we're just being heard in our little locality. So thank you
Exactly.
for joining us. Thank you for listening. Thank you for your comments. So yes, Nurse, I really appreciate that explanation of the first 10 days, because I think sometimes we don't really understand the importance. We know that we have to, we know that it's routine, but it's like, just another stress. After
Mhm.
you have gone through so much, it's just another stress, and so on. So thank you for that. I really appreciate it, because in that period, that explanation really lets us know the risk to the
Mhm.
newborn. That's a
Exactly.
very serious risk. So if that
Exactly.
is not caught on time, if those
Mhm.
issues are not caught in a timely fashion, we could have some very serious
That
issues.
is correct. That
Okay.
is correct.
So, nurse, can we think of any more threats? Um,
Yes. So we were looking at some during pregnancy and during childbirth, the hemorrhaging is a threat. Infection is a threat. And obstructed labor.
I think we just nurse just dropped off a little bit, but nurse was referring to some of the issues that may arise.
So you may have, we spoke about big baby. That baby, after the baby delivered,
Sorry to
should be,
interrupt you. Sorry to interrupt you, but you broke off just for a little bit.
oh,
So
oh,
if you could just go back to after you mentioned the hemorrhaging and the obstruction of labor, we can take it from there.
sorry. Mm. Can you hear me?
Yes,
Can
I
you hear
can hear.
me?
Yes, I can hear you now, Miss.
Okay. We had a little bit of a lag. I'm not exactly sure why we were going so well.
Yes, we will, and that's okay. It
Yes,
happens.
yes, yes. So, when we spoke earlier, during childbirth, one of the threats that can happen with obesity and with diabetes, for instance, is having a big baby, where the baby can be born large for the age. And
What's a
after the
large baby nurse?
a large baby is a baby that's bigger than what we want it to be. So baby might be bigger than our regular 8 pounds. That may be a baby that's 9 pounds. That may be a baby that's 10 pounds. Yes. And that baby being delivered, after the head is delivered, the shoulders can get stuck. The shoulders can get stuck, and that can cause the newborn to have a shoulder injury. That can cause the newborn to have other injuries during birth. And there are even instances for the mother where surgery has to be considered, a cesarean has to be considered. So these are some of the threats that can happen from some things before you deliver. Um, Preterm or premature delivery can happen. That can happen with high blood pressure and some other hypertensive conditions, but that can also happen with a low blood level. That can happen with substance abuse, alcohol use. That can happen with drug use.
So we're having a little issue with the internet. So once nurse is back on with us, she will continue from where the internet dropped. So we
Yes,
you as far as substance abuse.
yes, substance abuse. And a thing that a lot of people don't realize is a simple thing as a bladder infection can send you into premature labor. A bladder infection that's untreated can send a pregnant woman into premature labor. So managing these things are important. She may notice that she's peed a lot and may say, hey, I'm
Yeah,
pregnant, the baby's
exactly.
pressing. Yes. But along with that, there might be burning, there might be pain with it, and that will tell her that there is a bladder infection there. So these little things can be picked up and treated. So simple little infections can cause that. Infections after the woman delivers is also a threat to maternal health. Um, so she may have stitches, but she may not necessarily be soaking to clean up these stitches properly. So with the blood coming down there, I lie down. She doesn't realize she has to change her sanitary napkin every 3 to 4 hours. She may leave it there for too long and infection sets in. So these infections are a threat during infections are a threat after delivery for sure. For the newborn, infections are a threat as well. So newborns can get eye infections. They can pick up little things in the birth canal. Newborns can get infections of the navel, the
Oh.
umbilical cord after it's cut. Some people are afraid to clean it. Some people
Yes.
don't realize it doesn't hurt. They don't realize it doesn't hurt.
Oh, it
So you
actually
clean it,
doesn't hurt them.
it doesn't hurt. So a lot of times when you go to clean it, the baby screams. Not because it's hurting, but maybe um, the alcohol you use is cold.
Ah.
The baby may scream, and mom may say, oh my God, it's hurting," and they may not necessarily take the time and care to clean it properly. So babies can get infections of the navel. Babies can get infections of the eyes. So these are the main type of infections that we see after for the woman and for the newborn.
So Ness, how could a mother work towards reducing the risk of the newborn getting certain infections?
Um, Education, education, education. Knowing what to do, when to do it, how to do it, and if you cannot do it, where can you get the help for it? So, we mentioned earlier how important it is for the antenatal visits. These antenatal clinic visits at your wellness center, you get a lot of information. You get a lot of guidance. You learn so much. When I was pregnant with my first child, I was very happy to be sitting in a wellness center waiting room. I learned a lot. And sometimes we would sit there, and whilst we were, well, I wasn't really talking, Since it was my first baby, I had nothing to say. I was just soaking in all the information. And the nurse would step out when she would hear certain things. And that was a good opportunity for her to do a group talk, for her to hear what everybody had to say, for her to understand what was happening. So how, knowing how to recognize that there are threats and what the threats are is as important as being able to manage the threats, knowing what to do.
Okay.
And one of the things that we do have, all our all our pregnant women are discharged with this antenatal passport, pregnancy passport. And in this pregnancy passport, when we talk about getting the information, it has so much information for the pregnant woman that she can learn what to expect in each of her trimesters in her pregnancy, what she can do for certain issues, and even the danger signs, when she should run, when she should come and look for help, and so on. And whilst we do these antenatal visits, we use this to go through it with the client as well as we do our teachings, as we do our talks, as we have our conversation with how the pregnancy is going, that she also can follow us. And when she goes home, she has something else for her to use to guide her along through the pregnancy and knowing what she's looking for. Is this
Wonderful.
pregnancy going as she wants? Yes, yes.
Wonderful. Nurse, out of curiosity, are there any cultural beliefs that you would categorize
As I
threats,
said,
as a threat to
you
maternal?
preempted me, son. You preempted me because
Oh,
I
I'm so
was actually
sorry.
going to bring it up. So one of the and I hate to place it as a threat, but it is something that's cultural, and it doesn't put the woman at risk, but it does put the newborn at risk. So we give lock in St. Lucia. Yeah. And
And for those who
um,
may not know, could you just give us a little idea of what the lock is all about?
so traditionally, our women are told, they're taught that after you deliver, you need to get rid of the dead blood and so on that is in the pelvis that may just be lying there. As healthcare providers, we know that that is untrue. We know that with as the uterus contracts, all of the products of conception are passed out. However, um, a practice is that in St. Lucia is that we give a combination of various traditional and herbal remedies. It's a combination of items. Nobody really tells you what's in it. Nobody really tells you what's in it. But a few days after you have delivered, you may have granny or grand auntie or somebody coming and telling you, hey, you need to drink this. You need to drink this. Um, there are substances that pass through the breast milk and go into the baby's stomach. The newborn stomach is not developed for it to develop enough to manage some very harsh items. What I learned, and I literally watched it, my grandmother, when I had my first child, she said, Ishmael, where made a lock rabahu? I made the lock for you. You have to drink it after how many days? And I asked a lot of questions. So I asked, do I breastfeed? She looked at me very puzzled. She said to me, why would you have to breastfeed? Don't you know you cannot breastfeed when you take in milk? But traditionally, people they expect that you're supposed to know that as a woman in St. Lucia. And a lot of women don't know that you're not supposed to breastfeed when you take milk. You're not supposed to because some of the items are just too strong for the baby's stomach. It passes through the breast milk. We encourage women to express their milk and store it. They can do that. Um, but it is something that culturally culturally it can harm the cultural practice can harm the fetus. Yeah. Another one is something that does cause infections, the raises the risk for infections, is that persons are told that they're not supposed to bathe after they have had a baby. Yes.
I
That they
wasn't
must
aware of that
yes.
one.
Yes. So I think for 7 days or something
For
like that.
7 days. Wow.
Yes. For a good number of days, yes. And some women still do practice that.
So
Some
what do
women
they
still do
do in that
practice
period? Is it like just a sponge?
a sponge and so on. Yes. Yes, but with, as I said, with education, we're hoping that persons learn that some of these things are unnecessary, that they do increase certain risk for infection, risk for complications, and so on, and that they learn for themselves. Now, it is still a little tricky for certain persons because how can you tell your granny or grand auntie who you're not taking luck, you're not taking what they give you, and when you need to go to work, you want this person to watch the baby for you. So it's sort of straddling a very, very thin line, a very thin line. But we have evidence-based practice that we can use to teach our clients, to teach their support system as well. I encourage everybody who's taking care of the baby to come in, let me meet everybody. Who will be preparing the feeds? Who's going to be bathing the baby? Who's going to have baby when mommy goes to work? As she has had the baby, where is she staying? She may not be in her primary residence, but may have gone down to the countryside to stay with a relative. And we have 34 wellness centers where anybody can visit. So if you originally from Jackmel, but you went down to say Deriso, there's a health center down there. Feel
Yeah.
free. Don't say I'm waiting to go to my health center. We welcome you with open arms, and as many people that can be involved, that are involved in the care, who can be involved with the health center staff in managing this person after she has had the baby. We appreciate that because we know the support system is important.
You make a very good point, Nurse, because sometimes, other members of the family, other relatives play a very important role in
That's right.
caring for the newborn and for the mother. So instead of having only the mother come to the clinic and then for them, when they have the little disagreements with whatever nosla di,
It's true.
Nosla toujours que you serve. The nurses always think they know more than them,
True.
particularly maybe the older people, the nurses always feel they know. So at least they can come and they can ask their questions.
There you go. There you go. We encourage them. We love to have them because we get to learn a lot as well. Huh? We get to learn a lot as well. So
Yes,
on both
it's
sides, we
it's
benefit on both
actually
sides.
very good to know what's happening on the outside,
Of
because
course,
if you have no idea that the family is promoting certain behaviors, you cannot deal with them. You cannot advise. You cannot
you
make
can.
recommendations. You cannot
Mm,
reduce the risk of those things happening. So
happening. True.
unfortunately, Nurse, we've had a wonderful discussion. I enjoyed.
It's over. Oh,
I really enjoyed having you on the program.
it was a pleasure.
Very interesting insights and very good information coming out of your participation here today. And I really appreciate you taking the time to come on the program. I look forward to having you at some other point. I always want all the guests to come back, you
Yeah,
know? Because usually it's so much fun. And
it really
I
was.
I hope that the public was able to garner a lot of information from the discussion here today and to learn something new. I learned quite a few new things here today, and I
I'm happy.
appreciate that. So thanks again, Nurse, for joining us. Before we leave, is there anything you would like to share with the public to round off our discussion today?
Um, what I would like the public to know, as I said in the beginning, it's a partnership. And we provide a range of services at our wellness centers, not just maternal child health, but we provide services across the lifespan from birth to old age. And we encourage you to visit us. Come sit with us. Come see what we have to offer. Every wellness center has an open door policy. Our staff are trained, our staff are skilled, and we would be so happy to see you.
Thank you for that, Miss. So, to all of you out there, with such a lovely welcome, I hope that Nurse will be inundated with clients for all of her clinics at all of the wellness centers. So thank you again. Have a wonderful day to everyone. Join us again next week, Monday at 10 a.m. for another edition of Casualty 911 on 88.5 Sufre FM. Bye.
Thank you so much, Dawn. Have a wonderful day. Bye bye.
Goodness.